Yeah, hi, I'm Joanna Tan. I'm the Chief Executive of Children's Wishing Well. Children's Wishing Well is a registered charity in Singapore, and we support children from low-income families and disadvantaged backgrounds. So this is my 7th year here. Yeah. And before that, I was almost 20 years in the Ministry of Health, and that's where I started my career. Even now at Children's Wishing Well, I still volunteer at other charities. I gained a lot of self-confidence from that role, to believe that I can do it. I can do anything that I put my mind to. And that's the same kind of spirit that I brought here to Children's Wishing Well. I think to instill in the kids that as long as they put their mind to it, they can achieve whatever they want, they can achieve their dreams. Because I came from a lower income family myself, so I think it was made known to me. My parents told me very early on that they could not afford to send me to university, so it was up to me to work hard and to get a scholarship so that I can get into university. Parents were not well educated, but they were extremely hardworking. I saw that they were working hard all the time. My father came home late and he was working on weekends as well. And my mother always believed in us. She always told us that you have to be top in class. You have to score 100 marks. As a young child, I just thought, okay, yeah, I should. You know, she said you must, so I should. And because I thought that I could, I did it. Yeah, so it was really amazing, the kind of support that I got from my parents, their role modeling, their belief in me. And that's how I managed to get into university, managed to get the scholarship. The fact that I could see that they actually worked really hard for the family, that they devoted really their entire lives to making sure that we were comfortable, we were well brought up, that we had whatever we needed. I think that was really impactful for me. I don't think I could have achieved anything that I have today without them. When I was 15, I started doing my volunteer work. Yeah, I volunteered at many different charities, doing different types of odd jobs. I even did volunteer work when I was studying overseas. Yeah, so when I was studying in London, I actually went to teach English to those new immigrants' children who could not speak English, and then also brought some children with special needs out for outings. When I was 19, I ended up in hospital, and I was at the brink of death. And the nurses all came around my bed to pray for me. And I spent my 19th birthday in hospital. So I have this autoimmune disease that rejects my organs. So my kidneys failed, my liver failed, and I almost died. It's a lifelong condition, so on lifelong medication to suppress the immune system. Yeah, so I take medication that is for transplant patients, because my body thinks that all the organs are transplants and it's trying to reject them. It was a life-changing moment for me as well, that I decided that I need to have the courage to live my best life, because at that time I didn't know how much longer I had. I'm always conscious that I need to maximize whatever time I have lah. I chose to study physiotherapy. At that time, I had always wanted to go into social services. As young as when I was 15 years old, I had already made up my mind. But there was no scholarship for social work. Yeah, so the closest one that was related to the social services sector was actually physiotherapy. But when I came back from the scholarship, I was bonded to the Ministry of Health. And that's where I stayed for close to 20 years. I took one scholarship after another, and my bond in total was 11 years. And at that time, I think the social service sector was still very underdeveloped. So the pay was low, I think working conditions were not so good. It was not a desirable job that people wanted to go into. It was hardly the kind of job that people say, oh yeah, my ambition is to be a social worker. Healthcare is actually also an area where you help people, definitely. And I really enjoyed my 2 decades in healthcare. Yeah, actually made a lot of sacrifices along the way to get here. I had loans and mortgages to pay. I could not switch into this profession earlier, so I had to sell my house before I could make the transition here. But at that time when I came, the reason why everybody was so shocked was because I was already at a very senior position at the ministry. It's what you would call super scale, and people know the term. Yeah, so already on the super scale. And at that time, Children's Wishing Well was a single centre at a HDB void deck with no signboard. Yeah, so
you were struggling.
Yeah, and there were only 2 staff. Yeah, so people were really very shocked. Like, why would you do such a thing? Yeah, but I saw so much potential, and there was so much unmet needs and so many things that I could possibly do. And then some of my friends thought I got sacked or something. They said, how come you left? You get sacked? I was like, no, I won a National Day Award the year that I left. Now that we have grown to 10 centres island-wide, 10 sites island-wide, we have 2 full-service centres, and we have 8 sites in the community where we don't own the centre. So we operate out from a CC, or we operate out from a primary school. I don't want Children's Wishing Well to be big for the sake of being big. Yeah, it's not my wish. I wish for Children's Wishing Well to be useful to a child, to be useful to the children in Singapore who need our services.
So you're looking at impact?
Yeah, definitely. Like to do real things and not just to exist. So we pay vendors and professionals to come here to teach instead of relying fully on volunteers. So I believe that we need to give the best to our children in order for them to be their best. I'm deeply cognizant that at the end of the day, it's not for me to solve their problems. It's for me to provide them with the avenues, the resources, or the opportunities, and then at the end of the day, they have to resolve their problems. Yeah, I think that's what we are, all our programs at Children's Wishing Well does, that we're very clear that we don't give them the fish, because that's not a solution. Yeah, so that we teach them how to fish, we give them the resources for fishing.